Hey everyone, in this video I will give you tips for nursing job interviews for registered nurses in 2021. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a video every single week. Also, be sure to give this video a thumbs up if you found it useful, as it helps others see the video as well. Alright, so you've just finished nursing school and have taken off time to pass the NCLEX and are ready for your nursing journey. However, you realize that in school there is no education provided on how to prepare for nursing interviews. What will they ask during the interview? How should I respond, and what should I do to prepare for it? Well, in this video, I want to talk about certain aspects that I remember being asked and how I responded to them in hopes of helping others land your first nursing job. So typically the first question they ask is something along the lines of, why do you want this position? This is asked almost every single time, and the best way to answer this is just to be honest. I always say something along the lines of, I want to have a job as I need to support my family, but more importantly, this position aligns with my goals in life. I go on to further state that this position would be a perfect fit for me, as I want to learn about this field, and I've heard good things from this place from research I've done. This way, the employer knows that you're honest and have intentions of working there long term. Remember that these employers spend a lot of money training you on the job, and so they want to make sure that they have quality employees, but also one that stays in that position for a very long time. Another thing they like to ask are clinical questions. Often this is through the educator that works on the floor, but essentially the educator comes up with different clinical situations that are common on the floor or the work site you're working at. Therefore, it is important to be familiar with the patient demographic that the institution you're working from serves and the type of patients you'll see. So if you're applying in a cardiac ward, you want to do research about cardiogenic shock and what to do if someone starts presenting with chest pain. But above all, you always want to mention how you will stay calm and adhere to hospital policy guidelines. This is an important thing to say because it ensures the employer that you'll make the best decisions that will ensure patient safety. The other aspect that is commonly asked during interviews is something revolving around patient confidentiality. Patient confidentiality is very important, and you should try and make a statement about how you will try and promote confidentiality, often by saying something like how you always try and clarify the relationship to patients and family members, and always asking the patient if they're okay with giving medical information to their family. You can also mention that you take patient confidentiality very seriously and never talk about patient-related incidents to friends and family. Lastly, you want to try and mention how you have a strong work ethic. And you always want to mention how you're very reliable in terms of attendance, that you try to improve your nursing knowledge every shift. This shows that you're eager to learn and that you want to provide the best care possible. This is great from an employer perspective, as they want reliable and dependable employees that work to create a better environment for patients and other staff. So that's the end of this video. If you found it useful, please consider giving it a thumbs up and sharing it with a friend. I would greatly appreciate that. Thank you for watching, and let me know if you have any other suggestions for other nurses down in the description box, in the comment section rather, down below. Thank you so much, and see you in the next video.